Immediately after a woman has had a miscarriage, we need to ensure that the womb is completely empty and that everything has been properly cleared out. We don't want little bits of placenta or blood clot left inside the womb, which are then going to potentially complicate the future. So the immediate recovery, we would expect women to be bleeding, but by the time we get to about 2 weeks, we would expect that bleeding to have settled down. And I would recommend that if it's possible, women should get a scan at that point to check that the womb is really properly empty. We wouldn't expect ovulation to resume completely within 4 weeks, like you might normally imagine. So the first period may be a little bit delayed. And I would always urge women to wait before trying to get pregnant again until they've had their first period, because otherwise dating the pregnancy can become difficult and the whole situation can become very confusing. So there's initially some bleeding, then we need to wait for the hormones to get back to normal before women can get pregnant again. Now, I'm often asked, how long do I need to wait before I do try to get pregnant again? And personally, I do not have a view on this, apart from waiting for the first period. There are many of people who have opinions, but I think we need to be careful with opinions because that's all that they are. These things are not often very evidence-based, or the evidence is inconclusive. And in that situation, I think it's probably best to allow women and their partners to make their own choice as to when they might get pregnant again. So that physical recovery is quick, but the mental recovery can take a little longer. So I do ask people to ensure that they're in a good mental state to go through the stress of a pregnancy again before they undertake this. By and large, though, thankfully, the recovery from miscarriage is quick and women can rapidly return to their normal lives. When women are having a miscarriage, they will often ask me, what should I do? When we do the scan, we will often see there's still some blood clot inside the womb and maybe some little bits of placenta which need to come out. And there's a tendency for women to think, well, maybe I should just have this cleared out surgically rather than leaving my body to do this naturally. And then there are some women who think, of course, the opposite. They think, well, I don't want surgery. I'd rather wait for this to clear naturally without any intervention. And it's interesting because when you look at the outcomes, either way, they seem to be very similar. So things we worry about are bleeding, infection, and these retained products that I mentioned earlier. And it would seem that if you leave things to nature on the one hand, or you perform surgery on the other, the balance is about equal. It really is a personal choice. So there's some people who want it over and done with quickly. Perhaps for them, a surgical intervention is good. But for those women who would prefer to do things naturally, that's also a perfectly safe thing to do. We can give drugs as well, which can also be helpful. So one thing that I often suggest to the women who come to see me is that they might like to take some drugs to help to make the womb contract a little better, to actually squeeze out any products that there might be left inside, to prevent any damage that might occur as a result of infection in the longer term. Of course, women don't want any damage. They want things to settle down so that they can get on with trying again. Fortunately, most pregnancies that end in miscarriage do not affect the future fertility chances of that one. They can still go on and have children, and it's very rare that there are any consequences. The things that we worry about are if the lining of the womb becomes damaged, either because a surgical procedure has been performed too vigorously, or because infection sets in, or perhaps a combination of the two. And what can happen then is that during the healing process, the front and the back of the womb can stick together. And this then obliterates the cavity of the womb, making a future pregnancy difficult. This is something called Asherman's syndrome, but fortunately, it's extremely rare. So as we are concerned about it and need to be cautious, it very rarely happens. Later miscarriages are a slightly different thing. By what I mean by later miscarriages are miscarriages perhaps at 17, 18, 19, 20 weeks of gestation, where the etiology behind this might be rather different. And one of the things we worry about in that group is that maybe the opening of the womb, the cervix, is somehow weak or incompetent, so that as the pregnancy progresses, the neck of the womb starts to soften and shorten and open. And because of this, the membranes are exposed to the bacteria in the vagina, and waters can go and the pregnancy miscarries. Now, of course, that's a very different situation from the very early miscarriages, which are so common. But in this type of miscarriage, we would worry that in a future pregnancy, the cervix might be weak again. And under those circumstances, we may then place a stitch around the cervix at 12 to 14 weeks gestation in order to keep the cervix closed. So whilst most miscarriages will not lead to any consequences in the next pregnancy, there are some where we need to be more cautious and take action. Women often wonder how long they'll need to rest after having had a miscarriage. And thankfully, the answer is they really don't need to very much. Most women who have a miscarriage will go home the same day from hospital, even if they have a surgical procedure. And within 2 or 3 days, they're pretty much back to their normal function. There might still be a little bit of bleeding and some cramping like a period, but nothing worse than this. With some simple painkillers, women can get on with their lives as normal. When women are having a miscarriage, it's very important that they're properly supported. First of all, they need to be properly supported by the nursing staff and the doctors who they encounter when they're having their miscarriage and they're in hospital. And hopefully these healthcare professionals will then continue with some follow-up. Certainly in the private sector, we ensure that women can contact the nurses on the ward where they've been having their miscarriage. And of course, the doctor who is assisting them should also be available to go through all of their questions and to offer them the support that they require. In addition to this, though, some women will require longer-term professional psychological support. And there are many psychotherapists out there who specialize and who can help with this type of problem. And of course, it's our duty as doctors to put the women in touch with these individuals. There are also online groups, and I always try to encourage the women who I look after to look online and seek some help there. In the UK, the biggest group for this is a group called SANDS, S-A-N-D-S, who help a great deal of women who have miscarriages and other pregnancy problems leading to the loss of the baby. And they really support so many women who find themselves in this very unfortunate and very sad situation. So some of it can be through the original healthcare professionals, some through these online groups, and some psychological support, perhaps for a small minority from specialists in that area.